It is an honor to introduce you to a few of our inspiring EMS and Emergency Department colleagues from St. Mary's Hospital and our ministries in Waterbury, Connecticut. As emergency medical service providers, these colleagues are called into a myriad of situations, from the most basic calls to incredibly difficult and complex situations. No matter the situation, these colleagues perform their work with dedication, skill, and care, while also exhibiting several of our culture actions. Teamwork is a theme that stands out in high-pressure situations. Exceptional teamwork requires communication and trust, shared goals and accountability, and so much more. Let's take a few minutes now to meet the team.
911, what's the address of the emergency?
We received multiple 911 calls regarding gunfire at the mall.
15 shots fired.
We were the second ambulance on scene.
Used over to the legs.
Patient was already as stable as we were going to get in the field.
My name is Wes Kyle. I'm one of the emergency physicians here at St. Mary's. I also serve as one of the team physicians on the Waterbury Regional Emergency Response Team.
And we already have officers and an ambulance on the way, okay?
The Waterbury SWAT team had mobilized, and I entered the mall with the team as medical support. The entire mall had to be cleared systematically, and the number of casualties was quickly managed by the EMS personnel on scene and transferred to the appropriate hospitals.
I'm Daniel Skelly, and a paramedic and an EMS supervisor. I was there just as a paramedic mostly. It was great because all of our crews showed up and they didn't really need any direction. Everybody knew their roles walking into it, and it wasn't something that we even had an opportunity to rehearse. Everyone just showed up and worked as little teams, focusing on small aspects of that scene that all together kind of got the entire situation managed.
Update, a female was shot outside of IHOP.
I am paramedic Isaac Adelberg. I am one of the paramedics with Trinity Health in New England. 478. I'd come in on an overtime shift with a partner I had never met before. We had a couple calls and we fell into a rhythm together. So when we got the call to go to the shooting, we were the second ambulance on scene. As we were going in, another ambulance was coming out, and they said, there's a bunch of people in there. Your patient's gonna be one in the farthest back. So we went back there, and we were cleared by PD to go inside. I got there, I double checked, and the case had done a very good job with, it's called TECC, it's Tactical Emergency Combat Care. My job was already done. The patient was already as stable as we were gonna get in the field. As I'm walking out, I see Dan coming in, and he's very good at building up the rest of us, building our confidence. Part of why we work together so well as an organization and across the city is we have one training department, and we all study with the same protocols, under the same tutelage, with the same styles.
Teamwork in these events is actually much more complicated and difficult than the medical care itself. The trauma management is the easy part. The logistics of the situation, that's the true challenge. And teamwork amongst the organization is really what makes or breaks the event as being a successful event or an unmitigated disaster. These incidences where you have a mass casualty event, they are always chaotic by nature.
Copy 25.
One of the things that we rely on is our CMed dispatch, and they did an excellent job of coordinating our service, our EMS response on scene.
That's when you find out about people in those stressful situations.
And thankfully, our CMed, they're outstanding dispatchers.
EMS is one of the more unique jobs of healthcare. We have very little direct oversight on scene. So we need to have the level of trust between us and with our management and with ourselves and with our partners that we can do our jobs with the resources we have.
They are our initial hands in the field, and said many times that the individual who puts on the first bandage really decides the fate of that patient.
It's not something we do every day, thank goodness, but it is something that we are trained for, and we are trained to, when we are on scene, we are going to be calm. We maintain our teamwork and maintain our cohesion, and we unite each other for that.
Instance like May 27th, I'm happy that I was there with them specifically. It's always nice when you're on a challenging situation and you see people that you know and you trust. It makes the entire situation manageable.
We hope the colleagues in this video provide an example that will inspire all of us to continue to live our mission and to serve together in the spirit of the gospel as a compassionate and transforming, healing presence within our communities.